I'm honored to stand here today with my fellow Republicans, and first I would like to thank a number of people that are also here in the audience, members of the Medical Association of Georgia, the physicians, nurses of the state, health insurance companies, health insurance agents, and others. We really appreciate your strong stand for individual rights, personal freedom, and the right for all Georgians to choose their own health insurance. It seems like every day someone asks me, what can we do to stop President Obama's health care plan? The Georgia Senate Republicans are standing here today to publicly answer that question. Our country was founded on individual liberty and freedom, and we stand here on behalf of every Georgian to fight to preserve those freedoms. We're proposing the Health Insurance States' Rights Constitutional Amendment, invoking the 10th Amendment of the United States Constitution to protect Georgians from mandatory government-run health care. We must ensure that every Georgian has the freedom to choose any health care or any health insurance that they want. Our amendment ensures those freedoms and protects all Georgians by prohibiting any government from punishing any individual and any business that chooses not to participate in government-run health care. President Obama's health care plan is a federal takeover. As you know, the Democrats in Washington have proposed government-run health care mandates. They impose huge individual fines and penalties on people who choose not to participate and who choose not to join their plan. Our founding fathers must be rolling over in their graves because the 10th Amendment protects us from such federal mandates. United, we stand to fight for Georgians. United, we stand to preserve this freedom for all Georgians. United, we stand saying to Georgians and frankly to all Americans that if the people of any state so choose, that they can invoke the United States Constitution and the 10th Amendment and take a stand now against government-run health care. And we don't come here empty-handed without real common-sense solutions that work. Georgians deserve affordable, accessible, high-quality health care and health insurance that they can take from job to job. For the past 4 years, we've been working to make this a reality for every Georgian. We've passed major health care reforms. And because of our successes, Georgians are better off today. And our state is now the nation's leader in patient-centered, free-market health care reforms. Let's stay the course. Senate Bill 92 and 106 are now pending in Senate committees. These measures give individuals and families better access to health insurance and treatment plans that they can choose, that they can keep. And frankly, it saves the state millions of dollars. Senate Bill 92 allows families who qualify for Medicaid and Peach Care to participate in private health insurance with a financial scholarship. This will improve their personal access to health care and save the state up to 75 or more millions of dollars annually. Senate Bill 106 provides a financial incentive to encourage higher income individuals to purchase health insurance coverage for themselves and for their families. This is estimated to assist and help over 400,000 uninsured Georgians to stay on and to have access to health insurance. And many of these people are presently visiting our emergency rooms at taxpayers' expense. We are standing here today with one voice, speaking to President Obama, Speaker Pelosi, Majority Leader Reid, saying, no thanks, leave Georgia alone. With that, I'd like to turn it over to Senate Majority Leader Chip Rogers, and then we'll open it up for questions. Thank you very much for being here.
I'd like to thank first Senator Hill. He has been a voice on this issue, not just since we learned of the plan to take over health care in America, but many years before that, recognized the problem that Georgians were having, and we have addressed those problems in a very aggressive manner that has placed Georgia really at the top of the list of states who are using a free market approach to provide more coverage for more Georgians. Now, we could argue this issue of nationalized health care from a numbers basis, and it would be rather simple. In fact, the numbers tell us that the play or pay mandates are going to affect between 95 and 105 million workers, between 500,000 and 1.4 million employers, and that includes 1 million small businesses. The mandates will cost these businesses $49 billion per year and put 5.2 million low-wage workers at risk of unemployment or reduced working hours. This is common sense, folks. You cannot have a government mandate that is not going to cost jobs. It has never been that way. It will never be that way. If the government mandates something, you are going to lose jobs. But let's take it one step further, because the stated goal of this socialization of medical services in the United States is to have more people covered with insurance. Well, according to the Congressional Budget Office, not a partisan think tank, but the Congressional Budget Office, H.R. 3200 will result in a net increase of 3 million workers with employment-based insurance, but it will also result in 9 million, mostly low-wage and part-time workers, to lose their employment-based health coverage. Now, only in Washington, D.C., would adding 3 million and taking 9 million away be the answer. Only in Washington, D.C., could you come up with something that stupid. We are here today to say, listen, if you want to play this game elsewhere, we don't suggest it, but don't come to Georgia and put this on us. We're having a tough enough time. Families are struggling. We don't need more government mandates. And that's really what this legislation today is all about. It's about saying one thing very simple, and that is, in the United States of America, and particularly in the state of Georgia, you ought to have the freedom to purchase health care if you like. Our founders never would have envisioned a scenario where the government was taking over the healthcare industry and dictating to you when you can see a doctor, what doctor you can see, and if you deserve medical care. No, but they would, as Senator Hill pointed out, they've got to be turning over in their grave to even hear suggestions like this. So we're simply saying here in Georgia, leave us alone, we'll take care of ourselves, and in Georgia, you have the right to purchase health care if you like.
Our work here is not just beginning today. We've been working on health care savings for the last 3 or 4 years. One of the things we've done with our Medicaid program is simply demand that everyone verify their eligibility. That has saved us $50 million. We've taken 125,000 people off the Medicaid rolls, frankly, that didn't qualify for Medicaid. We were taking care of people that were fraudulent. That's saving a lot of money. Now we're concerned that the Senate and the House in Washington are going to force new mandates on Medicaid that will require us to cover more people. We can hardly afford to cover the least of these now. We're doing what we can to save money. We also have moved about 20% of our state health benefit plan to HRAs. That puts the consumer controlling the cost along with the provider rather than the insurance company deciding who's going to pay the bill. This has saved us around $90 million, and frankly, these savings have been very important in these austere times. So we're doing what we think is the right thing to save money now and to cover those people who really deserve to be covered and not those people who are, frankly, frauding the system.